Okay, now we will be testing the lower trapezius. So first we're going to establish that range of motion. Have them coming up, thumb up, so that the arm is laterally rotated. Okay, I'm going to palpate once again on the skin. Okay, and do that same motion. And then back down. Make sure they're close to the edge of the table. You're going to stabilize opposite scapula, and then your force is going to be on their forearm pressing downward. So come back up to that position and hold there and don't let me move you. Hold, hold, hold. Okay, relax. And you're watching for the scapula to either elevate or downwardly rotate.
Okay, we're going to be testing the middle trapezius now. I'm going to take the arm with the thumb turned up, okay, out at the side, 90 degrees of abduction. I'm going to have her slide a little more closer to me, to the edge of the table. We're going to check the range of motion first, okay, and then we're going to palpate. As she does that motion, lift your arm up, please. Thank you. Then we're going to go into the test position. Hold the arm up there, please. Stabilize on the opposite scapula. Give resistance on the forearm. On 3, hold there. 1, 2, 3. Hold, 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 hold. And relax. You're watching the scapula to see if it breaks into abduction because the middle trapezius holds it in adduction. Okay, we are testing the upper trapezius, specifically the right upper trapezius. We're going to check the range of motion first. You're going to rotate away, and you're going to extend and right side bend towards the right shoulder. Okay? And then I'm going to palpate as I ask her to do that motion. Bring your ear towards your shoulder, please. Thank you. Come back up. Okay. And then we're going to get her in the test position and try to pull apart the head from the shoulder. So let's bring your shoulder up towards your ear. Don't let me pull this apart. Okay, on 3, 1, 2, 3. Hold, 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 and relax. Okay, and you're just looking for separation between the ear and the shoulder. That would be showing that you're breaking the upper trapezius. And I guess that is it. All right, now we are testing the serratus anterior. In serratus anterior, we know that with shoulder flexion, the serratus anterior is part of the force couple, which does upward rotation of the scapula. So we establish that range of motion. We palpate for the serratus anterior and have them do a test motion. Then we get them into position and apply the resistance and watch for the scapula breaking. So the position is between 120 and 130 degrees of shoulder flexion. My resistance is going to be proximal to the elbow in this case. It's an exception to the rule of the long lever, because if we give resistance here, the shoulder flexors many times are going to give before serratus would give. And we want to test the serratus, not the shoulder flexors. So we're going to come proximal to the elbow with our resistance, and we're going to put our thumb on the lateral border of the scapula and kind of just be holding the scapula, feeling what's going on. Okay? And then we are going to apply resistance in a downward fashion. So hold here and don't let me push down. 1, 2, 3. Hold, 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 and relax. And the whole time I'm feeling back here what's happening. And what I'm feeling for is that scapula breaking. I might feel the scapula downwardly rotate, because that would be breaking it from the serratus, or I might even feel a little bit of winging of that medial border where it loosens and comes out from the thoracic wall. And that would be showing us that we've tested the serratus anterior and broken it.
Okay, now we are testing the supraspinatus. First, you're going to palpate on skin, not to clothing. Go ahead and raise your arm for me. Okay, and back down. Then I want you to raise your arm up to this position. Okay, bring it back down. Show me you can do that. All right. Then the testing position is going to be in abduction, slightly forward, slight external rotation, head extended, laterally flexed, and turn towards the opposite direction. Stabilize on the opposite shoulder. Force goes on the humerus, and you're going to press down towards their side. So hold there. Don't let me move it. Hold, 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 relax.
Now we're going to be testing the middle deltoid. First, we're going to have her move into abduction while I palpate. Okay. So I've palpated, and I've checked her range of motion at the same time. Then I'm going to put her in the test position, 90 degrees of abduction, elbow bent. We are going to provide stabilization on the opposite side, standing behind the patient, pushing straight down into adduction. And on 3, I want you to hold there. 1, 2, 3. Hold, 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 hold. Okay, and relax.
Okay, now we will be testing the anterior deltoid. So first, I'm going to palpate. So just raise your arm up there. Okay, and then bring in your arm up to that position and relax. Okay, so the test position is going to be into flexion, slight external rotation, and some abduction. You're going to stabilize over the same shoulder coming from the posterior side, and then your force is going against the humerus into extension and adduction. Hold there, don't move. Hold, 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 and relax.
Now we are testing the posterior deltoid. Going to palpate first and have her do the motion. So bring your arm up like that for me, please. And back down. Do that for me one more time again. Great. And down. So I've palpated and I've done checked range of motion. Now I'm going to put her in the test position, which is abducted and slightly extended and slightly internally rotated. I'm going to apply my stabilization on the same side of the shoulder anteriorly, so we're not over the posterior deltoid. I'm going to give my resistance into flexion and adduction. And on 3, hold, don't let me push your arm down. 1, 2, 3, hold, 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 and good. Okay, now we are testing the upper fibers of the pectoralis major. So we're going to first palpate the upper fibers, okay? And I'm going to have her pull across, good, and heel. And then I'm just going to double check her range of motion is good. We're going to put her in the test position. She's going to be flexed at the shoulder to 90 degrees, slightly internally rotated, and a little bit horizontally adducted. We're going to be pulling with resistance on the proximal forearm. We're going to be giving stabilization on the opposite shoulder. And I'm going to get into my stance. I'm going to be pulling and asking her, don't let me pull your arm away. On 3, 1, 2, 3. Hold, 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 hold. And relax.
Okay, now we are testing the teres major. So I'm going to palpate first. Okay, can you bring your arm up behind your back? Okay, and back down. So I also checked her range of motion there. So test position is bringing arm up in that position. I'm going to stabilize opposite scapula. I'm going to provide force on just above the elbow on the humerus into abduction and flexion. So hold there, and don't let me move. Hold, 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 and relax.
Testing the latissimus dorsi now. We're going to palpate as she extends. Okay, lift your arm up and back down. And we check the range of motion at the same time. I'm going to bring her up into the test position. Arm extended, adducted, slightly internally rotated. We're going to be putting pressure on the forearm proximally, and our counter pressure or stabilization is on the opposite pelvis. We're going to give our resistance down into flexion and abduction. On 3, hold. 1, 2, 3. Hold, 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 hold. Okay. And then if we were to test from the opposite side, you can have your patient come a little bit closer so that you don't have to reach so far, and you can have her come up, and I'm going to be applying pressure in that direction. Counter pressure here. 1, 2, 3. Hold, 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 hold.
Okay, now we will be testing the internal rotators of the shoulder. We're testing them as a group, so I'm just going to select 2 to palpate right here. You can have the latissimus and the teres major. So if you'll just bring your arm that direction, okay, and back down. Okay, the test position is the humerus supported on the table. They're going to be internally rotated. You're going to stabilize under their humerus to keep them from going into any AB or adduction. My force is on the distal forearm, so I'm going to have her come in this position. Hold there, and I am applying my force into external rotation. Okay, hold, 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 and relax.
Now we're testing the external rotators as a group. All right, so you're going to be standing above the patient. First you're going to palpate. So we're going to be palpating teres minor and infraspinatus, and she's going to externally rotate, and I'm going to feel those contract. And in so doing, we've also checked the range of motion. Okay, and then we're going to stabilize underneath the arm. The whole arm is supported, okay, up to the level of the elbow, and my stabilization is going to be keeping the humerus from going into adduction or abduction. I'm going to bring her up about mid-range of external rotation. I'm going to be giving a force this way into internal rotation. I want you to hold that position. 1, 2, 3. Hold, 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 and relax.